Hello everyone, so this video I'm going to talk a little bit about the healthcare costs in retirement. There's a new study that came out, and what it did was, interestingly, it compared Medicare Supplement and Medicare Advantage enrollees. So I kind of just want to talk a little bit about that and kind of how we can interpret some of the different data that also came out from the Kaiser Family Foundation about Medicare Supplements, Original Medicare, and Medicare Advantage and the study that they ran. But first, it says that the healthcare cost for retirement could exceed $300,000 for women and $264,000 for men. And this is just healthcare costs. It's not talking about cost of food, cost of basic needs and vacations. This is just for healthcare, and it's over, as you can see. If it's a married couple, 300,000 plus 264,000 is well over 500,000. So it's already exceeding $500,000. Now, if you retire later, you will obviously, your retirement time will be less, so you'll be paying less than if you retire earlier. They have a number out here that's pretty significant, like 50% more or something like that. But what they do say is that if you are on a Medicare Advantage plan with the Part D, so an MAPD plan, you will spend, as a healthy 65-year-old male, about $137,000, which is quite substantial, seeing that the costs for someone who is on a Medicare supplement, they estimate, is actually $264. So that's over $130,000 of difference. And for women, it looks like they would spend about $158,000. And then if they were on original Medicare, they would spend about $300,000. So that's a pretty huge, substantial amount of money, especially with economy not doing so well, and then also the Tesla just hit. Sorry. Oh, that's good for the market. So the market is not doing so well, and then inflation is at pretty high levels, so it's definitely eating away at your purchasing power. So how can we compare these two, right? If financially there's such a huge difference, what exactly are the key differences qualitatively? Because quantitatively, we know that looking at this, based on the study that Milliman did, which is a huge actuary firm here, and you can read the report here. I'll try and leave these links in the description of this video, but it kind of makes it very one-sided that, why would anyone buy a Medicare supplement plan if Medicare Advantage can save you like almost 50%, right, of the costs? And I'll show you, well, to compound upon this, as of 2022, almost half of Medicare beneficiaries are on an MAPD plan, so they are on the one that saves you more money on this projection that Milliman gave. And that number is expected to be over 50%. And President Biden did a huge favor to all the Medicare Advantage companies. I've seen the plans for 2023. The benefits have increased a whole bunch, giving away all kinds of good medical benefits on these Medicare Advantage plans. So it's not to say that the Medicare Advantage plans are not good and they do not save money, right? And they are very attractive, as this is there's a nice graph here that I can't seem to find. It might be on this one. Yeah, here we go. So this is the enrollment percentage of people who are on the Medicare program. The percentage of those who choose to enroll in a Medicare Advantage plan is 48% in this year, 2022, and that equates to about 28 million people. So the whole Medicare program, according to this number, would have about 58.6 million beneficiaries on Medicare getting both A and B. And then of those 58.6 million, there are 28 million on Medicare Advantage. So it can't be that bad, right, Matt? You can't, it's not to say that Medicare Advantage is like the worst thing since sliced bread. And I'm not going to argue that. What I'm going to argue, though, is that it is getting more popular. and the projection for people to enroll is, as you can see, increasing to 2032, with 60% of people. Heck, it might even be faster. So what are the experiences that beneficiaries have in addition in things like experience, affordability, utilization, and quality? And this is the executive summary. I'll leave this in the notes as well, but they also left the full-on report. So this is a full-on report, and this is based off a study of, they said they used 6 or 7 cases, and they compared quality. And what they've found, I'm going to just summarize it very briefly because it's very much of like a wishy-washy, this is kind of what we figured out, but there's holes in our research, and again, this is everyone's experience. And then it didn't really affect like the quality of care. So like, independent of whether or not someone was enrolled in a specific type of insurance plan, the quality of care that they receive from the doctors, hospitals, etc. seems to be equal. Does that mean that their insurance plan was the same? Effectively, when it came down to the quality of care that the physician delivered, yes. And that's obvious, because usually the insurance plan that you have is not really going to make a huge decision or a huge factor when your doctor provides you care, right? That's very, very, if that was the case, that would be very bad, and most likely that physician would be in hot water, and he probably would be disbarred or dismembered, or however you say, lose their license, right? So that's really not the, I guess, a good metric to measure when it comes down to choosing one or the other, right? Medicare Supplements or Medicare Advantage, or original Medicare and Medicare Advantage. What it comes down to is really how the costs are for you. Medicare Advantage enrollees, they say, end up spending about $321 per person if instead they were covered by traditional Medicare. Now this number here is also misleading, because it's not that the Medicare beneficiary actually utilized more care and spent more money out of their own pocket. What they're saying is that the Medicare Advantage program charged Medicare $321 more per beneficiary enrolled on the program than it would have cost for an individual who was enrolled in just traditional Medicare. So in the traditional Medicare sense, they are saving money, or Medicare is saving money. The federal government is saving money by having people not enroll in Medicare Advantage and enroll in a Medicare Supplement instead. So that's kind of why a lot of these reports, they're very, very perspective based, right? Because think about this for just one moment, entertain my tangent. You have Medicare itself, right? That's the program that has all the money, creates all the guidelines, and writes all these contracts. They have a huge issue. Medicare is going to run out of money like 2034 or something, hospital insurance, Part A. Medicare Part B, which is funded in part by the general fund, like taxpayer revenue, and Medicare Beneficiaries premium. So that part is pretty much, solvency is not an issue, because they can just either raise the premium or charge the government more, because that's just how the program it works, right? So they're okay financially right now, but they have a problem. They're going to run out of money. How do we fix that? Well, their idea was to bring in Medicare Advantage. Medicare Advantage was going to lower overall costs per head, per Medicare beneficiary, but they needed time to do that. So in 2006 and 7, when Medicare Advantage started, they say, hey, we need a little bit more money because this is different, in order for us to create infrastructure, create benefits, understand the population, but we're going to need a little bit more money than what traditional Medicare beneficiaries spend. So, makes sense, right? Unfortunately, that number has never decreased. So from a overall, I guess you could call it a macro look, Medicare Advantage is bad for the system. But it's not inherently bad for the individual Medicare beneficiary who is enrolled in it. Okay, I always say that in a Medicare supplement or original Medicare part, you're paying more to get access to care. So you, as a enrollee, can choose to get care wherever you want, however you want it, as long as you fall within the Medicare guidelines. That comes at a financial cost to you, right? And so we can go back to this wonderful thing about the healthcare cost. So yes, Medicare supplements will cost beneficiaries more money, right? Substantially more money. The quality of care they receive on a statistical holistic base will be probably the same, right? Most doctors don't care which insurance plan you come, they're not going to treat you really much any different, whether or not you have XYZ insurance company or ABC insurance company. A lot of times that is a non-factor unless you have, money hungry physicians. Then if that's the case, you would get poor care no matter what, you did really, unless you did what they told you and joined the plan that paid them the most money, which is most times not the number one goal of most physicians. So it's like an outlier that you would find. In addition to that, the kind of overall cost that you incur, right, when you are receiving care is better on the original Medicare Plus a supplement because there are no real cost constraints. You're not worried about getting a test because of the high cost. But Medicare Advantage has kind of lowered that by having plans that have very low costs. Like you can join a plan that might be an HMO, but the most you pay for the entire year is $1,000, right? As long as you stay in the network, you stay within their guidelines. So you're not really deterred by out-of-pocket costs that are too expensive. While yes, there are some plans in some areas that have very expensive services attached to their Medicare Advantage plans, but for the most part, most people, especially people who are watching this right now, that's probably not where you're living. These robust plans are for people who are living in the cities, people who are living where there's healthcare, abundance. They're like, major cities where a Medicare Advantage plan works almost exactly like a Medicare Supplement plan, except for the back end, right, where the prior authorizations and the network things and making sure everything goes through the insurance. That back end portion is where you might find some differences. And if you ask beneficiaries, they typically have no clue. I'm not saying that you guys are, this is your fault. It's not your fault because it's not what you do. So when you're a physician and you work with original Medicare, you just put the paperwork in. As long as the paperwork matches like what the guidelines say, boom, it's covered. For Medicare Advantage, the same physician, same scenario, puts in the paperwork, insurance company comes back and say, hey, we don't approve it that way. This is how we approve this service. So unless the patient meets X, Y, Z, you only got X and Y. We need Z, or we're going to deny it. Here, you got 2 days to call me up and contest this, or we're just going to flat out leave it as denied, and that's it. You have one chance to come back and appeal it to us, but if you don't, well, then just deny it, too bad. And that's how the system works, and the physician will have to call. But that doesn't influence. That is like normal protocol right now for everybody else who is not on the Medicare program. So in essence, like I say, it's not that different from what you had at work, but you have this opportunity to finally have an insurance plan that really works like, I'm going to use the term socialized medicine with protection on your co-insurance, right? That's what the Medicare Supplement does. It protects you from the financial outliers or financial costs of all the services that come with the social insurance plan. And the social insurance plan has guidelines and rules to follow, but those guidelines and rules aren't monitored strictly by an insurance company that makes money by not paying claims. So that's kind of my stance on it. I will be completely transparent. I'm sure you folks know this, but I sell both. I do Medicare Advantage or Medicare Supplement, since I've been talking about Medicare Supplement with my right hand, and I do Medicare Advantage. I'm actually writing a book right now on how to choose a Medicare Advantage plan because I feel like there's a lot of agents out there who do not properly walk through the steps. And it's not the agent's fault either. Most agents aren't trained on how to really find a plan that makes the most sense. And you got to remember, we as agents have from October 15th, which is in about a week and a half, through December 7th to help as many people as we can choose the best plan for them. And we have hundreds of people potentially calling us, and those people, they just want to know what the best one is. And a lot of times they're not going to know what the best one is. So I'm writing a book. It's a short book, probably won't be more than 50 pages in total with worksheets and everything in it, for people to kind of look at what the metrics that matter are on Medicare Advantage plans. Because you can't change a lot of things on the plan. Some things are just standard. What are those standardized things? What are the metrics that truly matter to you? How do you find those? And then how do you apply those to choosing a plan that fits you the best? And that's kind of where, Medicare Advantage requires a lot more upkeep and a lot more work, because unlike Medicare Supplement Plans, where the benefits are pretty much covered from A to Z, irrespective, I don't like that word, but regardless of what service you choose, because it just matters between A and B. There's not really much more complication or the complexity to the plan other than that. Whereas Medicare Advantage has a ton of moving parts, but a lot of those moving parts are not that important to everyone. They're important to some people, but really they're not important to everyone. Like, what is the true difference between $45 and $40 copay to see a specialist if you only see a specialist one time a year? Is it even worth your mental effort to consider it? Probably not. But for someone who sees a specialist every week, oh yeah, $45 and $5. If I have a plan that costs me $10 more per month and saves me that $5 and I go every week, heck yes, I want the plan that costs $10 more per month to save $20 a month, right? Makes the most sense. And that plan that has $10, it might have more things on it that would potentially save me even more money. But unless that's the kind of benefits that I need, I shouldn't care. But a lot of times, Medicare beneficiaries don't really take those things into consideration before enrolling in a plan. They might look at a plan and say, well, this plan is $10 a month, this plan is $0. Why would I pay $10? It's the same company. I'll just get the one that's $0 per month. And that's why it doesn't make sense. Now, I don't know why I'm talking too much to you folks who are probably all on a Medicare supplement plan anyway, but that's kind of my take on this article, why it costs more. The true kind of quality of care you receive is probably going to be the same regardless of where you go, but the back end portion will be so much more smooth if you choose a Medicare supplement over the Medicare Advantage side. So that's kind of what I said. If you want to learn more about Medicare Advantage, and if you have to enroll in one due to financial constraints, or just you feel like this amount of money difference is gonna really make or break your lifestyle, make or break your, maybe not even make or break your necessities, and want to talk about what's available in your area, I would be more than happy to discuss what kind of plans are available in your area and how much they would cost you and what the kind of restrictions would be based on the network. I am, again, licensed. I'll put the states that I'm licensed in under here, but that's kind of where I'm going to end. You guys have a great rest of the week. I hope you guys have a great weekend. Remember, for all you guys on Medicare supplements, you do not need to change it. AEP, really, I just need to review the drug plan. So if you updated your medications, just send me your updated medication list and I will run it through my software, which will allow me to choose the best plan based on the medications that you have financially, okay? You guys have a good rest of the week. Do good things. See you later.